know there's a couple little myths. We've kind of talked about it a little bit, and we've kind of alluded to the 240 languages that Montfort can help with. Maybe you
Yeah.
can tell me more about that.
Yeah, it's so important. And like we started, like people kind of know us for as a francophone, and we've already talked
Yeah.
about our patients is very different. But so like you're right, like the population with the increasing diversity in our population and all this stuff. So there's definitely a key requirement to serve the individuals in their language of choice.
Hmm.
So MOFA and its foundation, like we basically, through the philanthropic donors, and like the donors with gifts and all this stuff, we introduced a linguistic tool called Voice.
Hmm.
So this item allows any medical professionals or staff to interact in the language of choice of the patient for up to 240 languages. So we have live interpreters that are available, and it's just not a
Live.
linguistic. It's not
Yeah.
just a linguistic. Those interpreters also have a medical background, so they can
Oh,
understand
wow.
terms that are being
Yeah, yeah,
transferred.
yeah. Because it's so
So you
specific.
basically,
Yeah.
so let's say I walk in and I don't know, like I speak Arabic or whatever, and like I can't exchange with the doctor.
Hmm.
This I can speak. The translator will inform the doctor. The doctor will inform the translator. The translator provides the information. So it's all
Hmm.
live, happening right there when you're sitting with
Yeah.
the patient, and it's available 24/7. So
Wow.
it's an amazing tool.
Yeah.
So we've integrated it. I know Chio has integrated it in the last year as well. So it's definitely a tool to serve a diversified community,
Yeah.
like we have here in Ottawa.
Yeah, and even if you went to the hospital with like a family member that could speak, like, interpret, like, so they may not even understand the nuances of the medical terms, right? Like, so they'll actually understand, the very like specific human body parts or the actual issues,
Yeah.
and the nuances that I think is what's missed when someone can't speak your language. So that's a pretty big move. Yeah.
Yeah, it circles back to what when you first introduced the podcast, right? When you say like
Yeah.
a miscommunication, this is
Yeah.
one tool that will minimize those miscommunications so
Yeah.
patients get the right care at the right time and within the language of choice. So
That's critical. And I guess, like, how can people kind of reach out or contribute? Like, what's the best way for people to kind of do that?
yeah, so definitely like you said, we're gonna post certain things. So like well, we
Yep.
have definitely the best part is Montfort's website. So
Yep.
definitely, so there'll be a number of links that way. Uh, but like sometimes individuals want to do a little things personal, and
Right.
maybe I can share a little bit. Like we have a platform called Impact Platform.
Hmm.
So an individual that wants to do a personal fundraising because he believes in Montfort, wants to do something. So one example that I'm going to be doing, it's going to
Okay.
be coming out shortly. I'll be turning 65. So one thing that we're
No.
going to do is
Wow.
we're going to give my birthday to Montfort. So I'll initiate a little fundraising campaign
Yeah.
and try to raise, and we're going to put like 6,500. So I mean, tag
Okay.
into the 65 and try
Yeah.
to raise fund for a cause. So like maybe like
Yeah.
if I say I want to continue support the voice program for linguistic
Mm. Okay.
perspective, I would gather my friends and invite them to make a donations, and hopefully they raise 6,500 and support a specific program. So
Hmm.
you can get involved at that level. So it doesn't have always have to be a big thing. But
Yeah.
the thing is, every dollar makes a change in somebody's life that is a patient at Montfort. Every
Yeah.
dollar makes a difference.
Yeah, and I know, especially as like business owners, because a lot of our listeners are business owners. Like, you're part of like doing some different events throughout the year. You're sponsoring events. Like this is one of the charities that you can sponsor, right? Like,
Yeah,
if you're going to be doing an annual golf tournament, whatever, like, and you're rotating your charities. This is a charity you could be supporting, right? Like, if you want to be
exactly.
kind of charitable to your clients, you want to make sure your clients can see that and all of that. Here's a good charity that you can kind of show that would impact your clients as well. So I think there's a lot of great impact to be had here. And yeah, thank you, oh my god, so much, Robert, for your time today. This has been really good. I guess, like, for me, one of the critical kind of takeaways that I'm getting here is that Montfort is more than just a hospital, right? Like, it's a lifeline, it's a family, it's a community, and a place where language isn't a barrier, but it's
Yeah,
actually a bridge, right? And
yeah,
where care isn't just clinical, but it's actually very personal. and the community means everything in this case, right? So with the support of the audience, the support of you, Robert, we can help ensure that Montfort continues to be that beacon of healthcare excellence for everyone to kind of walk through these doors and have a good experience. So this is great.
No, thank you, Eric. This is it's been an honor to be chatting with you about Montfort. And you're right, like it's we're Montfort as a family. It's critical, but like just for us, like the way we usually wrap things up, and we always say, philanthropy leads to excellence. Excellence saves lives. Be part of the excellence. So we
Mm.
invite everybody to be part of that.